6:43 now, and many experts agree that America has a youth mental health crisis. For example, emergency rooms have seen an uptick in young people coming in for mental health reasons.
A new report card looks at how the nation's schools are handling the crisis, and Wake Up Central's Michael Laren is here with a look at how Arkansas scored.
We're just seeing more severe behavior, additional referrals for mental health issues.
Dr. Betsy Kendall works for the State Department of Education, serving as project coordinator for Arkansas Aware. The federally funded project helps districts with school-based mental health programming.
Arkansas has 30,000 kids that are getting mental health services, and most of those services happen at school.
Kendall says it's important to meet kids where they are. That's the goal of the Hopeful Futures campaign, created by 17 organizations, including the National Alliance on Mental Illness.
This is a crisis. We have to do something for our children. We're very concerned. And why not start in the school district? That's their environment. They're there every day.
Hopeful Futures released the first ever America's School Mental Health Report Card this month. It shows Arkansas does not meet the mark in several policy areas.
I think we have a long ways to go. However, I do think that the report is not a really good representation of everything, all the good things we have going on in our state.
When it comes to the ratio of students to school mental health professionals, Arkansas fails, according to the report. It suggests the state invest in, quote, significantly improving the ratios of school psychologists, school social workers, and counselors in K through 12. But Kendall says there's an obstacle getting in the way.
Arkansas has a clinician shortage like many states across our country.
That's the reason she says the state is working to train all school staff, not just teachers and administrators, on how to identify and help struggling students.
Just because a student needs some assistance doesn't necessarily mean that they always need a mental health clinician.
State law currently requires all public school personnel to complete 2 hours of teen suicide prevention training. Arkansas Aware also offers mental health first aid training.
We provide the trainers, we provide the materials, anything and everything that's needed to get that training done.
It's not required right now. Starting next year, school counselors and resource officers must complete mental health first aid.
We've really tried to hone in on training for staff because we feel like I mentioned earlier, that our educators have to be in a really good place to go into that classroom and support the kids or recognize even their needs.
The Arkansas Department of Education is also making teacher wellness a priority. They also offer mental health first aid to community organizations. Ever important right now.
Yes.
All of us collectively have been through so much, and we can't overstate the impact that this is having on young people too, who are trying to navigate not only just growing pains, but all of this that's happening around us. It's just such a crucial time.
I think even all of us who would probably say, yes, we've got everything together, we feel fine, our life is going great. In times like this too, especially, I can't imagine growing up right now.
Oh,
and all
right?
this is going on with all the distractions and everything going on with not only social media too. So yeah, that report card is not what we want to see,
right,
but let's get it better.
Yeah, let's improve and work together to help. It's a crucial time for sure.